Hello, and welcome to the Duke Global Health Institute's Research Showcase. I'm David Gendel, Duke class of 1983, and chairman of the DGHI Board of Advisors. And it's my great pleasure to welcome you to this annual tradition where we celebrate the outstanding research projects undertaken by Duke Global Health students during the past year. Of course, our event is a little different this year. Because of the COVID-19 pandemic, we can't be together in the Great Hall of the Mary Trent Seaman Center, enjoying casual conversations as we look at our students' research posters. We certainly hope we can return to in-person events soon. But one benefit to meeting virtually is that we have invited a truly global audience to help honor our students' work. So I want to welcome the faculty and students, parents, friends, mentors, alumni, and global partners who are joining us today. And most of all, on behalf of the board and the entire DGHI community, I want to extend my appreciation and admiration for our students. This has been a very trying year for students at every level. Beyond managing remote learning and caring for family members and loved ones affected by the pandemic, our students were confronted by a huge challenge: how to do fieldwork without actually being in the field. And yet, with the help of their mentors and our excellent education team, they rose to meet that challenge. They found new projects where they could apply their skills, including many that directly addressed issues related to COVID-19. They traded field placements for Zoom meetings and WhatsApp messages. And in the process, they displayed some of the most important qualities for success in global health: resilience, patience, flexibility, humility, and an incredible will to persevere even in the toughest of circumstances. Obviously, these were not the circumstances any of us wish for in your education. But the pandemic has shown a bright light on the importance of global health to all of our futures. We've seen how interconnected we are, how a global health crisis anywhere can quickly become a crisis everywhere. And we've seen the only effective way to meet such threats is by working together across political and disciplinary boundaries. This is the most important lesson of global health. And it's one you'll see reflected in many ways in our students' research projects. More importantly, I think you'll see it reflected in our community. On the Board of Advisors, we talk about how important it is for DGHI to serve as a connector for Duke students and alumni at every level who care about global health. And that's one of the reasons why I'm so pleased to be a part of this event. I want to encourage all of you to remain engaged with the world and with each other. If you continue to turn to each other for ideas and inspiration, you will carry us very far toward a healthier, more equitable future. Over the next hour, we're going to hear from some of the students about their research. I think you'll find the creativity and resolve of these students remarkable, and they've done amazing work. But these are just a few of the projects our students have completed this year. If you haven't already, please take some time after this event to browse all 37 research projects featured on the DGHI Showcase page. On that site, undergraduates, master's, and doctoral global health students have put together pages about their research projects, including posters, videos, and other materials. These projects span a diverse range of topics, from assessing stigma relating to cervical cancer in Kenya, to the association of green space and depression in Ethiopia, to looking globally at donor perspectives on the impact of global-19 on maternal and child health services. These projects represent partnerships in 17 countries. All of these projects represent the culmination of a year or more of work, a lot of late nights crunching data, and early morning Zoom meetings to discuss findings with global partners. If we were gathered in person, this would be the moment I would ask for a round of applause for our students' amazing talent and effort. But since we can't show our appreciation with applause, I would encourage you to follow up with students after this event to share some words of encouragement. So with my thanks and admiration, I will turn it over to Laura Bai, who will introduce our first panel.
Thanks, Dave. So DGHI's annual Student Research Showcase is something the entire DGHI and Durham Global Health communities look forward to each year. And as Dave mentioned, although we're unable to host Showcase in person this year, we did not want to let the pandemic stop us from highlighting the impressive work of our students. So you'll see in chat that we dropped a link to where all the student projects are available on the website. But today we want to feature 4 second-year Master of Science students who will present a brief summary of their thesis research. And save your questions. The students' contact information will be available at the close of their presentations. But let's start with Cordelia Kenny, who worked with Dr. Dorothy Dow, examining factors impacting sustainable implementation of adolescent mental health interventions. Cordelia.
Thank you so much, Laura, and good afternoon, everyone. So as Laura mentioned, my name is Cordelia Kenny, and I'll be talking to you today about factors impacting sustainable implementation of adolescent mental health interventions through the perspectives of key stakeholders. So as a bit of quick background, this study was motivated by growing evidence that adolescents broadly and adolescents living with HIV specifically experience relatively high rates of mental health conditions. So for example, 16%, or about a sixth of adolescents aged 10 to 19, the global burden of disease is mental disorders, and up to half of mental disorders present by age 14. At the same time, mental health is severely underprioritized globally in terms of public financing and human resources, and there are few tools that are tailored specifically to adolescent mental health, and of those, many have not been sustained beyond the pilot stage. So we have a significant research to practice gap, and this study sought to better understand what can help sustain programs for adolescent mental health over time, specifically in East and Southern African country contexts, as that's where 71% of adolescents living with HIV live, and also where mental health systems are comparatively quite limited. And in terms of community, as Laura mentioned, my mentor and supervisor for this project is Dr. Dorothy Dow, who is based in Moshi, Tanzania at the Kilimanjaro Christian Medical Center, where a component of this project took place. And Jen Headley and Gavin Yami also served on my thesis committee and provided guidance all along the way. And some components of the project were also supported by research assistants from Fortunata Nasua and Kingdom Rinzava, as well as Kalei Hisaka, all of whom are currently based in Moshi. And so in terms of findings, through in-depth interviews with key stakeholders such as national policymakers, health aid donors, technical advisors, pediatricians, other clenacians, academic researchers, as well as a focus group discussion with peer group leaders of a Tanzania-based adolescent mental health intervention. Here's just a very quick snapshot of some of the key findings. So in terms of challenges to sustainable implementation, the main ones that were identified include low mental health literacy or awareness across the health system, as well as insufficient mental health system capacity. So some specific examples of what that looks like is lack of funding, not enough mental health professionals, and low prioritization of adolescent mental health in policy, which also links back to low mental health awareness. But participants did identify numerous promising opportunities for more sustainable implementation, and these include effective stakeholder engagement or the meaningful involvement of key stakeholders. And in the words of one participant, engagement should not be tokenistic, it should be meaningful. Adapting appropriately to context and approaches that are born out of community needs and realities was also identified as an important implementation enabler. And related to that, building community ownership of the intervention and adopting a multi-sectoral or integrated approach can also help build political will and improve mental health awareness. In the context of limited human resources for mental health, integration of adolescent mental health programming into the broader health system or with other health services such as HIV care and treatment is also was also seen as a strategy for overcoming some of these health system constraints. And then finally, participants identified having the right framing or right narrative as really important. So specifically linking adolescent mental health outcomes to national economic growth or broader social development writ large. And then, so what's next? So there are lots of possible directions to go in terms of policy, practice, and research. This is a very exciting space, but I'll just quickly go over a few key areas for further research. So first is just the concept of sustainability itself, and this needs further research in terms of how it's operationalized. So that's getting at how do you actually define and measure sustainability, and particularly in East and Southern African contexts. Second, implementation occurs in very dynamic environments that are constantly changing. So we need a better understanding of how to effectively brace for that kind of inevitable change. There's some nascent work in the implementation research space that is starting to look into this question. And then third, finally, participants in this study identified ownership as an important enabler of implementation. So a better understanding of what that ownership looks like and how to ensure a meaningful sense of ownership across different stakeholder groups simultaneously would be very helpful. So with that, thanks so much for listening. And if you have any questions, please feel free to reach out, and I'll turn it back over to Laura.
Thanks, Cordelia. So next we have Siddhesh Sade, who worked with Dr. Joao Visasi measuring access to surgical care in rural India. Sid.
Hi, thanks, Laura. Hi, everyone. Thanks for joining. I'm Sid, and today I'll be talking about some findings from my thesis. The project focused on surgical care in rural India. This was a secondary data analysis where we assimilated data from eclectic sources, created high-resolution estimates and indices. Next slide, please. Despite its massive global disease burden, surgery has been left out of global health for a long time. In 2015, the Lancet Commission on Global Surgery started a corrective recourse. It reported that 9 in 10 people in LMICs do not have access to basic surgical care. The findings spread awareness and brought surgery to forefront of global health. In that spirit, the Commission, along with local stakeholders, also set up National Surgical Forum in India to understand and solve the surgical care access problems in the world's largest democracy. However, there has been negligible political buy-in in the last 5-6 years. One reason for this is the lack of data, particularly in rural areas where healthcare provision has been historically neglected. The National Surgical Forum also highlighted the same need for research on India's rural surgical care. Hence, one of the main aims of my thesis was to map timeliness to surgical care access, surgical capacity, and expenditure for rural India. Next slide, please. One of the biggest challenges in this project was assimilating data. We combed through dozens of reports, data repositories, surveys, and other data sources. Finally, using data from some of these, we conducted analysis for the financial year 2017-18 as the baseline for 666 districts in India. As you can see in the first map on the left, we found that over 99% rural people were within 2 hours of their nearest surgical care facility. However, our model assumes that people have motorized vehicles readily available to them, and hence it should only be considered an upper bound estimate. Regions in North and Northeast India have severe access problems. We measured met surgical need by major surgeries, that is, surgeries requiring anesthesia, relative to the Lancet Commission's threshold of 5,000 operations per 100,000 people. We found that nationally, India has met little less than half of its projected need. However, you can see in the map in the center that there are several districts shown in brown, spread throughout the country where rural surgical need is not adequately met even now. A booming 61% of rural households faced catastrophic expenditure when they took surgical hospitalization as treatment. This means that these people spent more than 10% of their overall household expenditure out of their pockets on getting a surgery. Most districts had over 50% of rural households facing such a catastrophe. Next slide, please. The findings that you saw today contributed to about half of my thesis. This was the first such study creating nationwide estimates for surgical care indicators that could initiate India's national surgical plan. We also synthesized the first ever geodatabase for well-tagged surgical care facilities. All our algorithms are open source and can be used by other researchers working in other LMICs. Currently, we are developing applications and dashboards to help researchers and policy analysts to easily use these analytical tools and also our findings. However, the study had certain limitations. We need to conduct validation analysis and error analysis and kind of take a deeper dive into understanding the local policy context of these findings and how they fit in. Next slide, please. My journey at DGHI has been nothing short of incredible. This thesis started with just one class on global surgical care that I took in the first semester. One of the best things to happen to me was that I was able to forge a friendship with my mentor, Dr. Joao Visosi, who showed full support for this as a thesis idea. Joao also helped me through the challenges of the pandemic year. Like everyone else, I had alternating cycles of enthusiasm and absolutely zero productivity. At times, it's kind of difficult to make sense of what is the worth of what you're doing and what does it mean when the world is literally facing a pandemic. But during COVID times and while working on rural India's problems, I have come to a small realization that doing research in areas where it is needed the most gives a great sense of gratification that can help you feel a little bit more purposeful. And the best way to go about it is to take things one day at a time. Next slide, please. So I would like to thank my mentor, Dr. Joao Visosi, and everyone at Gemini Lab, all my friends and the wonderful, wonderful people at DGHI, my amazing peers at Association for Socially Applicable Research in India. All of these people have contributed to this thesis in one way or another. Thanks for joining us today. Please reach out to me on this email for questions, feedback, or if you would like to collaborate. Thank you.
Thanks, Sid. So next we're going to hear from Abby Turner, who worked with Dr. Charlie Nunn on the influence of spatiotemporal factors on small mammal trapping and species distribution in Madagascar. Abby.
Thanks, Laura. Hi, everyone. I'm Abigail Turner. Thank you for being here today. My project was titled The Influence of Spatiotemporal Factors on Small Mammal Trapping and Species Distribution in the Sava region of Madagascar. I'd like to give a special thank you to Charlie Nunn, my thesis advisor, and my committee chair members, Dr. Gregory Gray and Dr. Paul Lantos. Additionally, I'd like to thank Kayla Kuffman, Dr. Tuki Randa Ramoria, and all the members of the Nunn Lab, including our team on the ground in Madagascar. Next slide. The project setting was Mandena, Madagascar, which is located in the Sava region of the island, which is outlined here in orange on the map to the right. The island of Madagascar is currently experiencing deforestation at an alarming rate. From 1950 to 2000, the island lost 40% of its natural forest coverage due to anthropogenic land use changes, with agriculture being a main contributor to those changes. Over 70% of the rural population of Madagascar engages in agriculture. The main crops grown in Mandena are vanilla, sugarcane, and rice. Mandena experiences two seasons, a dry season and a wet season, which helps create fertile soils ideal for agriculture. As humans alter the forests for crop cultivation, the new landscape of agricultural fields creates easily navigated habitats for small mammals, especially invasive species like rats and mice. As animals carrying zoonotic pathogens interact, disease will continue to spread through animal populations and eventually spill over to humans. Partners in association and support of the project and other research from the Nunn Lab include the Duke Lemur Center and the Bahatra Association. Next slide. So my project investigated spatiotemporal factors on small mammal abundance and distribution within habitats of varying land use changes, and how small mammal population dynamics are linked to zoonotic disease risk. Small mammals were trapped within 6 different habitats: sugarcane fields, rice fields, vanilla fields, brushy fields, primary forests, and secondary forests, all which vary in human disturbance. The traps aimed to capture 5 different species of small mammals, 2 endemic or native to the island and 3 invasive. The sampling occurred within 3 different times of the year to capture seasonal variation. The first aim of the project was to assess the influence of season and habitat on the abundance of small mammals within these different habitats and how the abundance of mammals may affect disease spread. The second aim of the project was to investigate the distribution of small mammals within habitats and how the distribution changes over seasons. As you can see below, how animals are distributed and throughout habitats can increase or decrease the amount of interactions and affect the disease spread. An aggregated or clumped distribution has the highest likeliness for interaction, with a uniform distribution having the least. The project also assessed the species diversity for habitats, as the amount of diversity within habitats also affects the amount of interaction, with a high diversity decreasing interactions and a low diversity increasing interactions. Next slide. There were 2 main conclusions from the project. First, highly disturbed habitats like agricultural fields had a higher abundance of small mammals, especially invasive species. Since these habitats have a higher abundance of animals, there is also a higher risk for interaction and disease spread. Second, highly disturbed habitats had a lower species diversity and aggregated or clumped distribution patterns, which increases the interaction between species and also increases the risk for disease spread. The findings of the project support evidence that more intensive land use changes, especially involving agriculture, increases disease risk and disease spillover to humans. To summarize, less disturbed habitats have more small mammal diversity, which dilutes the disease risk. The evidence supports that disease risk is highest in disturbed habitats. Invasive species, which are known to carry zoonotic diseases, are more common in higher disturbed habitats, and animals are more likely to be clumped in distributions within these higher disturbed habitats. Next slide. There are some limitations to my study, though. Some of the analyses were limited to only using 2 seasons of data due to delays with the 3rd season. Future analyses should include the previously excluded season for a full picture of spatiotemporal influences on small mammal abundance. Extensions of this research will also include data collected from within village boundaries to determine how disease may be spreading within the local communities. And additionally, the projects will extend to include a larger spatial scale for a bigger picture of how small mammals are distributed and actually interacting, which can lead to the influence of disease spillover to humans. Next slide. So thank you guys. If you have any questions, please feel free to contact me.
Thanks, Abby. So finally, we move to Zoha Faruqi, who worked with Dr. Gavin Yamey on a qualitative study assessing the impact of COVID-19 on maternal and child health services. Zoha.
Hello, everyone. My name is Zoha Faruqi, and I'm a 2nd year Masters in Global Health student. I will be sharing some of the main findings from my thesis titled The Impact of COVID-19 on Maternal and Child Health. This was a qualitative study of donor perspectives completed under the great mentorship provided by my advisor, Dr. Gavin Yamey, and support from the Center for Policy Impact in Global Health. The motivation for this project came from a study published in the Lancet Commission in May 2020, which focused on the early estimates of the indirect effects on child and maternal mortality in lower middle income countries. My study focuses on the indirect effects, which entails all those consequences of the pandemic when the health system comes under strain. So the deaths due to consequences of the pandemic and not COVID-19 itself. And so it was reported by UNICEF in just the first 6 months that there were an additional 56,000 maternal deaths and 1.5 million child deaths, which meant that 20% of children and mothers across the world were out of reach of essential health services. Next slide, please. So my study had 3 main aims. Firstly, to examine how maternal and child health services were impacted, to understand how donors and governments were responding to the health needs of mothers and children in developing countries, and to explore what funding and policy decisions were made and what future donor priorities would look like. And to our knowledge, this is the first study that captures the wide spectrum of responses from all the leading health donors on service disruptions of maternal and child health services. Next slide. So this was a qualitative research design in which we conducted interviews using a semi-structured study guide. All data collection happened remotely, where we did virtual interviews. We identified the main donors who provide aid for maternal and child health, and then the eligible participants were reached out via emails through various professional contacts of our research team. And in addition to purposive sampling, we also used snowball sampling, and we were successfully able to reach connected us to other donors who were involved in COVID-19 response and were willing and able to participate. And then these are the main bilateral and multilateral organizations, and participants came from this group, but because of confidentiality, we cannot reveal the exact specific organizations. Next slide. So there were 5 main themes that came out from the study. Firstly, we saw that disruption of services happened both on the due to demand side and supply side factors. On the demand side, there was lack of transport, fear and stigma to access health facilities. And then on the supply side, staff had to be redeployed. There were weakened supply chains. Health workers were unable to provide antenatal services. There were contraceptive shortages, etc. We also tried to understand how organizations were supporting countries. And so during COVID-19, and how maternal child health services were particularly impacted, and what roles were played by both donor organizations as well as country governments, and how that was changing. We also found what was working in countries that were doing well, and we found that countries who had experiences with previous outbreaks like Ebola, how they were using evidence from that time to inform a COVID-19 response, and then how donors were formulating future long-term approaches. Next slide. So an important part of the study looked at the relative roles of donors and country governments, and participants reflected on how they have supported countries in the past and how they're rehashing certain policies given the pandemic. And participants shared that they had to rethink priorities, and this was a time where they had to grant flexibilities, and it was not a time to be fighting individual battles or focusing on specific areas or diseases, but rather they needed a more coordinated response to fight a disease which was still very new and unknown. They were providing technical assistance in whatever shape and form they were able to. And then they were also issuing guidelines and protocols for continuation of essential services, health worker safety, etc. At the country government level, participants believed that there was a need to speed up data collection efforts, keep public informed of mitigation strategies, and also to ensure that health workers felt safe. Next slide. So main policy implications were that at the country level, there needs to be better reporting, monitoring, and analysis to understand patterns of disruptions and vulnerabilities within and between countries. Leadership at the country level needs to be strengthened. It should be evidence-based. Governments need to be transparent with the public and to understand what people would comply with, and so that they're able to negotiate with donors about specific needs for their countries. For donors, they need to make investments more sustainable, rely on data sources provided through national governments instead of deploying their own human resources, and also make investments in overall system strengthening, particularly innovations, digital technologies, etc., and also to prioritize other areas such as investments in global health governance. Next slide. So this is my thesis was part of an ongoing study, which will also incorporate the perspectives of in-country policymakers, and then results would be analyzed in the context of donor transitions and be substantiated with findings from surveys being conducted by WHO, GFF, etc. Next slide. We will then be using this to prepare policy briefs to be shared with policymakers in different countries. So that's it. Thank you to everyone who has been a part of my journey, and for everyone listening in today, please reach out on this email if you have any questions.
Thank you so much, Zoha. Thank you to all of our presenters. It's really fascinating presentations there. So now let's turn our attention to a panel to hear in part about the flexibility and resilience of our student researchers. So In spring of 2020, so that was just a year ago, as the pandemic progressed and challenges increased, faculty and students in all programs were forced to adapt their research pursuits and project activities, sometimes modifying their existing work and sometimes pivoting to address the emerging needs of the global pandemic. To gain a better understanding of how their respective projects came together despite unprecedented hurdles, we are joined together today by a student panel featuring Master of Science student Liz Imony, undergrad student Sarah Watkins, and doctoral scholar Jackie Gerson, with Duke faculty member Dr. Tony Fuller as moderator. Please place your questions in chat. We'll be glad to collect them and follow up on them later. So Tony, over to you.
Well, hello, everyone, and hello to Jackie, Liz, and Sarah. Just really excited for this conversation. As a start with Dave presented, the challenges that you all must have faced during this time of being a student during an unprecedented time in our history, and then trying to do research, be a student, and get everything done at the same time must have been an incredible challenge. And so we're really looking forward to hearing your perspectives and thoughts about this. And so to kick us off, as Laura mentioned, there must have been some pivoting that happened during your time with research projects that you may have put a lot of effort into already, but then needed to pivot. So really this first question for you all, and anyone can jump in, is what are some of the things that were key changes that you had to make to pivot your research when the pandemic hit, or when you were beginning to start your new research projects? Anyone can jump in.
I'll go.
There we go.
So I had the privilege of last summer being a part of Global Health Institute's SRT program under Dr. Dennis Clements. So we were supposed to be doing research on the island of Roatan, Honduras, looking at vision tests and nutrition data for children in the public and private schools of the island. Which we quickly realized once we moved remote could not be done anymore due to inability of international travel and staff restraints, and just the fact that in-person schooling was no longer happening for those children. So to pivot, we met with the director of our partner clinic on the island, Clinica Esperanza, and we started brainstorming potential projects that both connected our team's interests also with the needs of the clinic. And so the clinic had just received this incredible grant funding for maternal health. And I'm really interested in reproductive and maternal health. So I worked with the director of the clinic, Peggy Stranges, and we worked to create these questionnaires and surveys that the staff on the clinic could give to mothers who were attending for their prenatal and postnatal checkups. And so we completely switched around the project. We were supposed to be looking at vision and nutrition in children, and then we just completely switched over to looking at maternal and prenatal care. So I think the biggest thing we learned from that is just to be completely flexible and to learn to work with both what your interests are and also the needs of your partner organization. Yeah.
Definitely, that's really important, working with the partner organization to develop the goals and kind of figuring out where do they want to move forward, during this time. Jackie and Liz, do you have anything to add from your experiences? Like, how did you all approach this pivoting that might have happened in your projects?
Yeah, I guess to build on what Sarah said, we did something similar in that I had been working originally down in Peru for my project, and I had a small pilot project that I had been working on in Senegal that generally I had been a part of and had been participating actively in. And instead of it relying on my presence, I started to rely a lot more on my community partners within Senegal itself. And so they took a much larger role in terms of carrying out survey developing, carrying out the entire project themselves. And it was a really great opportunity for me to train them and have them really take a lead on deciding where the project was going and being major players in all aspects of it instead of relying on me. They did an amazing job, and that's an opportunity I wish we had taken advantage of earlier on. And I learned the importance of not necessarily needing to be present, and that they could do a really great job without my needing to supervise every aspect of it.
Kind of differently from our other guest speakers, I had to switch from primary data collection to secondary data analysis, which completely changed my research question, how I was planning on conducting the analysis, the whole thing. But I think that made me grow as a researcher, and I'm not, disappointed with the end result.
Excellent. So you each touched upon this, obviously this need to pivot, and then from the comments, really focusing on communication with the community or the partner that you're working with. And so that seems like a big lesson learned of just ensuring that communication is there, ensuring that you're really, trying to talk with the community partner about what's working. And then Jackie, you pointed out this realization that you don't actually need maybe to be there all the time for these things, and just that active communication with the partners. And so outside of those comments, are there other lessons that you all learned from this experience, either challenges that you faced that taught you lessons, or really positive things that you learned from needing to pivot or doing your research during this pandemic time?
I think for me, I really improved my skills in project management, which is something I had been interested in, after this program career-wise. So I think that was something unexpected that came out of the thesis. Also, I think skills in interpersonal communication and having actually a better relationship with international collaborators, being aware of time zones, and while following up in communications is challenging, I think being able to work past that has made future partnerships easier. So I think it's shown that, the future of this program, for example, you don't have to do the summer field work. Of course, everyone wants to do the summer field work, but it's not necessary to have successful international partnerships. And I hope that the international partners that we do have more of a role in the research and can shine and show that they are just as contributive to the end result as the students are.
I would say one of the lessons I learned is the importance of establishing a set of communication and how frequently that communication is going to happen and via what outlet, and then ensuring that everyone's expectations are the same. I think I was really excited for this opportunity to have my partners in Senegal kind of run with the project, and they were really excited for it as well. But our expectations of what we were getting out of the project were slightly misaligned, and we didn't realize that right away. And it took us a little while to get back on the same track. And part of that was the reason it took us a little longer was because we were communicating both via WhatsApp and via email and via text. And it was just a matter of many different styles happening, some people wanting more frequent communication than others. And so I think I'm really excited about where we've gotten to now. But if I were to do this all over again, having an initial meeting where I lay out my expectations for what the final product of this project is going to look like, what the timeline to get there is going to look like, and then how frequently we're touching base with each other, and whether that's going to be in a formal report or whether that's going to be via WhatsApp or phone conversations, or just kind of laying out all those details ahead of time, and it coming not just from me, but coming from community partners as well, in terms of what they're comfortable with and what they want and what works with their schedules and their availability to internet, I think would be really useful.
Yeah, similar to what Jacqueline said, I think being really intentional about your communication and consistent is really important. So similarly, my project group had to rely on the staff workers of the clinic we were partnering with to administer the survey. And we realized through the communication with the staff on the island that a lot of our questions in our questionnaire became obsolete, just as Clínica Esperanza stopped offering as many services and kind of shifted to focus on COVID-19 cases. So we had staff that were out sick, and we had switching of services throughout the summer. So also having a flexible timeline with that for getting data in, just understanding that we're putting a lot of trust and a lot of work and responsibility on the staff that are already so graciously partnering with us. So just being extremely flexible and attentive and communicative, and just reaching out and trying to help in any way possible.
So you all touched upon a couple of things that I think are really important, right? Of the communication, but then also really trying to find a way to ensure that everyone is on the same page with how a project is moving forward. And so what I want to ask you all is like, what are the tools or things that you use? So obviously there are a ton of different ways to ensure communication, right? Zoom, which we're currently using, is one of them. WhatsApp, Microsoft Teams, Google Meet, all of these different things. And as Jackie, you mentioned, there are lots of other ways to communicate with people. And so what are some tools or things that you all use during your projects that really helped you to ensure communication was flowing well as expectations of what you all were doing with a project? Everyone had a clear idea of what the next steps were.
So I've actually found that WhatsApp is the best way to have conversations, just given limited availability of computers and internet, and just quick check-ins via WhatsApp frequently are really useful for both ends to have questions answered, and then just have email communication. And I think I guess it depends on the situation, but people that I've been working with in Senegal generally are not very technologically capable. And so anything more complex than a Word document, even a Google document where we're all editing it simultaneously, has been challenging. And so having just Word documents sent to me that I then compile in a folder and can refer back to, and can keep receipts as they're emailed to me as they get them, all within a folder in my computer, has been the best way, rather than relying on my counterparts to do that. And it kind of takes the burden off of them for having to compile all the information and worry about lots of technology.
I would say using a standing meeting, whether you need to meet or you don't, just instead of having to figure out a time every week or every month, even just having a specific day that you know that you're going to meet with your collaborators makes it much easier. And if you need to check in, you can. And if you don't need to, and come with an agenda prepared and make the most of the time that you have people on the phone.
Yeah, I would agree. I think that having a consistent meeting time is really important, but I also think that there's this really interesting blend and blurring of the lines of what is personal and what is professional now in terms of communication. So I think that texting and WhatsApp is something immediate. So if you have a question that's not necessarily needs to be occurring in this meeting that happens every once or twice a week, I think texting is something that has been really helpful and really beneficial for my project team. And it sounds like Jacqueline's as well with WhatsApp. So I think that this idea of needing to be professional in an email can also translate over to as many other types of communication as possible, specifically and especially for remote projects.
Definitely. So I do a lot of research and work in East Africa primarily, and I could not do my work without WhatsApp. It is a primary mode of communication with everyone there. So an additional question that comes up in this is kind of the realization that obviously you all had some kind of deadlines, right? Because you want to graduate eventually, or you want to complete your research projects. And so how did you balance the need to progress your research with the reality of the pandemic hitting and causing some of the people you might have been partnering with to have their attention diverted elsewhere that may have shifted the focus from research projects to just trying to manage what was going on with the pandemic? So how did you all kind of balance that? I need to graduate and finish this at some point, versus understanding that, okay, things may go a little bit slower, or we may not be able to hit all the deadlines that we set out initially.
Go ahead, Sarah.
Okay. I was just going to say, yeah, my program, the SRT program through the Duke Global Health Institute, is intended for just a summer, 8 to 10 weeks. And I'm still working on it now. So that is definitely something that I'm still figuring out myself. But I think, again, just being really flexible and open with your communication, especially with your stakeholders, whether it's the Duke Global Health Institute or your partner organizations, wherever you're doing research. So just working with both entities, and also knowing yourself and knowing your own schedule, just to create smaller final reports along the way. So I think all of us have this idea of like a thesis paper or a final report being however many extensive pages, but I think along the way creating reports has been really helpful for me. So for my specific project, we were intending to do pre and postnatal data comparisons, and at the end of the summer I could only do prenatal data, and I'm now working on postnatal. So just working with what you have and trying to extract as much information as you can has been really helpful for me.
For me, I would say the first priority would be to graduate. So I focused on the project to meet the requirements of the thesis, but then any publications after that are just kind of a bonus. So I think being flexible, doing secondary data analysis, doesn't always lead to an original article. So I think being open to a brief report or just a presentation to your partner organization can also serve as ways to disseminate data. So being flexible in that, meeting the first goal of thesis requirements and graduation for me.
Yeah, I completely agree with Sarah and Elizabeth that being flexible is really important, and like being aware of what limitations are. For me, I guess as a PhD student, I know that I'm going to continue doing research and that I want to continue working in Senegal. And so I've accepted that having this fully completed by the time I graduate is just not going to happen, and that I want to do the project to the best of my abilities possible, and that the publication will come out later. And so I've kind of let the community partners guide how things can happen, and when they're able to work, that's great. And when there's COVID considerations, their safety comes first. And so that's been completely fine with me. And it's taken longer than it would have taken in a non-COVID time, but I also wouldn't be doing the project in this way and probably wouldn't be doing this project otherwise. So it's all kind of part of the game, I guess.
So with the last little bit of time, so I guess one big thing that from our conversation that we might have not dove in fully into, but from your responses, is that you really worked with the community partner to really try to ensure that the community needs were at the core of the decision-making process, and then working very deliberately with the community to ensure that, yes, there are these external things that may be pushing you, but allowing the community partner to really drive the decision-making, as well as to ensure that whatever the needs were from the project were kind of secondary to whatever the needs were for the community in terms of the immediate things that needed to happen, or even with the pivoting of your research. And so my very last question, and I think we have like 20 seconds each maybe as a response for this, would be, from this experience, each of you is planning to go on to some next phase. And Jackie, you just mentioned about continuing to work. And so maybe what is one big thing that you're going to take with you from this experience that you'll carry into the next steps of your career, especially as we get out of this current pandemic situation and into something post-pandemic? What are some of the things that you plan to carry with you? In like 20-second soundbite or something from each of you.
I can go first. I think empowering local communities to voice their ideas and to lead the charge with researchers, particularly researchers who are not from that country, taking a step back and just providing the expertise and the resources and the ability to amplify their voices.
Just to add on to that, I would say reframing the question instead of a needs assessment as an assets assessment, and seeing what you have to work with and using that as a motivator to move forward.
Yeah, I would say just asking your community partners what they would most like to focus on, and starting from there, and just bringing the humanity back into research, especially now in a remote setting, just realizing that there are faces behind the data points that you're working with.
Definitely. Well, I want to thank you all. I mean, the insights that you provided during this time, clearly, I'm happy that all of you are going to be working in this space and be fellow collaborators in the global health as you continue with your career. So thank you, Jackie, Liz, and Sarah, for providing your insights today. And then we'll pass it over to, I believe, Laura, who will jump in and talk about what's next. So thanks again.
Yeah, thank you, Tony. Thank you, Liz, Sarah, Jackie. That was a really interesting discussion that I think we could continue for quite a while longer if we had the time. But please, let's stay on. Let's switch and talk a little bit about student project awards that are going to be presented by our interim and illustrious DGHI director, Dr. Dennis Clemens.
Illustrious, I'm not sure, but at any rate, I'm here. That was a fabulous panel discussion. I thought it brought out so many points that's all about global health. The emphasis on the equivalent of a letter of agreement so both parties know what they're getting in for. And that whatever the timeline is, it'll never be long enough. Such great lessons. And the other thing they focused on was what the community needs to drive what we're doing. And if you look through the posters and all the other posters are, you can see the URL there in the chat. I mean, they're just fabulous, and they all speak to exactly what we heard about today. I want to thank all the people here participating today. What we've said about the students' resilience during the past year has been phenomenal. They put up with a lot and endured it, and they've even embraced it and come out with lessons they probably wouldn't have learned otherwise. The positive spirit they have is an inspiration to all of us. I also want to recognize all the people who've helped the students pursue their research goals this past year. The list begins with faculty advisors, many of which were mentioned today and will be on the posters, and their mentors which are often on their committee or otherwise at DGHI. They've devoted hours to helping students navigate the challenges of this kind of remote learning and research. We are so fortunate to have partners around the world, certainly with my team, the ones in Honduras, for instance, that provide guidance, support, and an invaluable local perspective to our students' work. And we owe a huge thank you to the members of our education team who have really been asked to do the impossible this year. And they've done it with such grace and good humor. Illustrious, for example. And finally, I want to thank our students who have just been incredible, not just in the way they've completed their work, in all the ways they've supported each other. You've all forged bonds through this experience, and I hope you will continue to nurture them. So now it's time to name our poster winners. And I think, there we go. Before we do, I'd like to thank the judges of this year's poster competition. These individuals, all graduates of the Master of Science in Global Health program here at Duke, reviewed and judged all the posters submitted despite their busy schedules. So please join me in thanking Courtney Wimberly, Melissa Manus, Asma Mirza, Delaney Logan, Maya Stevens, and Beth Iannelli. All right, so 3 posters will be honored. They all received wonderful feedback from the judges, and the scoring was very close. So all of you should be very proud of your accomplishments. First, our runner-ups. Ta-da. All right. We have Elizabeth Imani, Barry, and you've already seen her just a minute ago. Barriers to uptake of sexual and reproductive healthcare services in Harare, Zimbabwe, a comparative stakeholder analysis. And Natalie Vance, quantification of Plasmodium falciparum cyclophilin 19B transcripts in normal and sickle trait hemoglobin red blood cells. Thank you both, great job, and great that you've been honored as runner-ups. And now for our winner. Congratulations to Hiwat Zode for her poster, Association Between Green Space and Depressive Symptoms Among Young Adults in Addis Ababa, Ethiopia. Among the many positive remarks, judges particularly noted how easy this poster made an otherwise difficult topic to be understood. What an outstanding accomplishment, especially in the midst of a difficult year. Congratulations to you all. I'm clapping for the 58 people online for you. Congratulations again to our winners. Winning posters will be posted on the Showcase webpage, along with all the other posters right after this session. And that brings us to the end of the Showcase event. Please be sure to check out all the students featured on the DGHI website and share your feedback and appreciation with our students. Thanks again for taking time to join us, and we hope to see you all next year in person. Thank you all very much, and congratulations to all the students.